how can we decrease the risk of liver cancer, as I kind of suggested?
Yeah, so I think there's a big, desire to actually have chemoprevention agents that can actually decrease liver cancer risk. When we take a look at this across the board, the most effective prevention strategies that we have are those for viral-related liver cancer. So, for example, from a population perspective, hepatitis B vaccination programs are actually critical for us to reduce the burden of liver cancer globally. And we've seen nice studies where when those large-scale hepatitis B vaccination programs have been implemented in certain countries, we've seen a nice decrease in liver cancer over the subsequent years. Similarly, we know that if people are screened for viral hepatitis, either hepatitis B or hepatitis C, and undergo treatment, those antiviral treatments are also associated with a significant decrease in the risk of developing liver cancer. And once again, we see this for both hepatitis B and hepatitis C. In the United States, this is particularly important for hepatitis C because we know that this can be common, particularly amongst patients with any risk factors for hepatitis C, and this is a curable disease with very short courses of treatment. There have been a strong search for other strategies that we can reduce the risk of liver cancer in patients without viral hepatitis. Those patients with alcohol-related liver disease or metabolic dysfunction related liver disease. And right now, there's some early studies that suggest promise for a lot of agents, suggest promise for things like even coffee or statins, but we don't have good large-scale data that show the true effectiveness of these agents to reduce liver cancer. So we're not using those routinely at this time. So for those patients, largely what we recommend are simple, quote unquote, lifestyle changes. So, eliminating alcohol use if one has liver disease, controlling weight, controlling diabetes. These things, we believe can reduce the risk of liver cancer over time. And so those are, our mainstay of recommendations outside of viral hepatitis.